healthcare logistics platform, AllTrak, has raised 4.2 crore rupees in a pre-Series A round led by Inflection Point Ventures. Now, the startup was established in 2021 and offers a single-point patient data entry and integration across platforms to reduce the turnaround time of diagnostics. It currently operates in 50-plus cities and has over 5,000 registered healthcare professionals. Joining me now to speak about the company's growth story and their key offerings for the healthcare space is Amit Gupta, the founder and CEO of AllTrak. Amit, thank you so much for joining us on Startup Street today. Like I said, you offer end-to-end solutions to diagnostic companies. You have a whole host of them. So can you talk to us about what these solutions are and how are you using tech to improve the efficiencies for these diagnostic companies?
Sure. So first of all, thank you for having me on your show. So at AllTrak, we are building a bouquet of solutions and services for healthcare companies for India and world. We operate in two business verticals. One is end-to-end tech ecosystem, end-to-end tech stack for healthcare companies, so that healthcare companies, specifically diagnostic companies, they don't have to invest capex in building technology and time. That solution is already available with us. And second vertical is we are building end-to-end tech-enabled logistics network for healthcare companies to collect, pick, and transport patient samples at a faster pace. We are already present, including all tier 1 cities and most of the tier 2 and tier 3 cities. So I believe that in India, if pizza can reach in 30 minutes, we are providing that service. We as a B2B companies, you want to build a bouquet of services to, if India has to grow, India is currently 3.2 and $10 trillion by 2030. There are few sectors which has to grow with that target, and healthcare is one of those few critical. Want to grab that opportunity to build a robust ecosystem for healthcare companies so that we can start serving patients to tier 3 and tier 4 cities in India.
Absolutely. So healthcare is one of those sectors that needs to grow along with the economy. But you've raised a little over 4 crore rupees. So how do you plan to spend these funds? Are you looking at more fundraisers and any new offerings in the pipeline?
So this is our first fundraise. We want to utilize towards 3 categories. One is towards building technology. We want to build and offer robust technology, keep improving, keep adding more solutions based on technology to healthcare services. One. Second is you want to build extensive logistics network, enable healthcare companies, diagnostic companies to go to tier 3 cities, tier 4 cities. We are already present into 50 plus cities. We want to go deeper into our existing cities and add new cities with this. Third, to building a robust sales team also. These 3 categories. Absolutely.
So these are the 3 key areas where you're going to spend your money. Now, your platform claims to track and monitor about 7 lakh patient samples per month. So how are you going to grow this further, and what's the impact that you're currently creating?
So India has around 1 lakh plus diagnostic labs, and we had just touched a very small part of it, right? We want to build technology so that companies which do not have funds available to build technology, we do not have time to build technology. We are saying, take our technology, automate your process, and grow your business. If companies will grow their business, we grow with them.
All right. And, let's talk numbers then. What about revenues that you're clocking? And what are the targets that you've set for yourself for this year? How much are you already making, and what are the targets for this year?
We are currently at 24 CR ARR, and we have aggressive targets. Now we have funds, so we have aggressive targets. We are investing in hiring team. We are looking at our numbers, and next year we want to do numbers which are like X multiples of our current numbers.
All right. So okay. All right. Now the tech-enabled logistics network facilitates healthcare operations in over 50 cities. So talk to us about your reach currently, and how do you plan to grow this further? Where are you seeing most of the demand from? Because currently you're in tier 1 and tier 2, and what you're trying to do is move deeper into tier 3 cities. So where are you seeing the most demand right now?
So most of the healthcare companies currently, they are concentrated towards tier 1, tier 2, and at max tier 3 cities. We have developed our network in last 18 months in tier 1 cities, tier 2, and India has 6 lakh villages, right? Towns and villages. Healthcare companies by themselves, they will not be able to go in all those small towns and villages. We want to build a bouquet of services with our technology, with our logistics network, to offer to companies so that if they want to reach to tier 3 and tier 4 cities, they can take our technology to automate their process, scale, and our logistics network to start their offering in those cities.
All right, Amit, thank you so much for joining us on Startup Street today. We're completely out of time on the show.
Thank you.
Okay, thanks Arundhati for taking us through that conversation. On that note, we have to slip into a short break. But on the other side, Antler India has launched an ONDC-focused platform for founders. We'll tell you all about this initiative and more after this short break.